As for the philosophical base in mental health, so OT is based on the belief that occupation may be used for health promotion and wellness, remediation or restoration, health maintenance, disease and injury prevention, and adaptation. Mental illness is a growing condition that affects many people throughout the world. Occupational therapy can be used to assist in the health promotion and wellness of individuals that are affected by mental illnesses. As more of the population is affected by mental illnesses, OTs will have to direct more emphasis towards treatment and prevention of these issues.
History of occupational therapy in mental health. So think tanks formed to increase the presence of occupational therapy in mental health, which dates back to the late 19th century at the time of the Hull House in Chicago, and often involved the inclusion of experts to develop strategy or influence change. The think tank grew into a grassroots action organization whose interests and work revolved around various areas of mental health and occupational therapy. The World Health Organization, also known as WHO, has identified mental illnesses as a growing cause of disability worldwide and predicts that in the future, mental illness, especially depression, will be the top cause of disability. In response to this trend, increasing emphasis will be placed on mental health treatment and prevention services for children, youth, the elderly, and those with severe and persistent mental illness. As more of the population is affected by mental illness, OTs will have to direct more emphasis towards treatment and prevention of these illnesses. Theories in mental health. Psychological theories attempt to explain how mental health problems develop. Theories provide ideas for what to do with a patient. Theories can also help you analyze observations and predict future behavior. There are 6 major theories that are used in contemporary mental health treatments. This includes object relations, developmental, behavioral, cognitive behavioral, client-centered, and neuroscience. Object relations is a psychodynamic theory based on the work of Sigmund Freud. This theory believes that humans have drives to satisfy needs governed by id, superego, and ego. Mental illness occurs when the ego is unable to achieve a successful compromise between the id, the superego, and the demands of reality. Mental illness is determined by our relations with objects in our environment. Human actions are influenced by defense mechanisms, actions undertake to ward off anxiety or pain, such as displacement. Freud believed that objects or symbols seen in dreams held the key to the meaning of unconscious conflicts. OTs following the theory of object relations use symbols in arts, crafts, and everyday activities. This theory is not widely used due to its limited usefulness in most situations. It is useful to provide a structure for thinking about how the mind works.
Developmental theory. If emotional or social growth is interrupted, a developmental lag may result. Mental health problems occur when developmental tasks are not successfully mastered. Once the lag is identified, an OT can design situations that will facilitate growth in the deficit area. There are 3 major difficulties with this approach. A related theory used in psychiatric occupational therapy is developed for adaptive skills.
The behavioral theory is based on animal research by Pavlov and Skinner. This theory believes that actions that have pleasurable results tend to be repeated. Actions that have negative or unpleasant consequences tend to not be repeated. People develop through a process of learning from the results of his or her behavior. OTs change a person's behavior by changing the consequences of the behavior. This is known as the action-consequence approach. Techniques that are used are identification of terminal behavior, determination of baseline, reinforcement, continuous schedule, intermittent schedule, shaping, chaining, and systematic desensitization. Behavioral therapies have quick results, but criticized for treating people like they are machines and using punishments. Modified behavioral concepts are activities, therapies, and social skills training.
Cognitive behavioral theory. Human behavior is based on what we think and believe. The mentally ill have maladaptive thinking, which results in undesirable behaviors. For example, persistently thinking nobody likes me results in introverted actions, which drives others away. Cognitive behavioral approach attempts to link a precipitating event to a person's thoughts about the event, and then the feeling these thoughts evoke. Aaron Beck variation most widely used and involves cognitive rehearsal, self-monitoring, retribution. Albert Ellis developed rational emotional therapy, or RET, which works with the ABCs of human experience. Albert Bundra investigated the effects of social modeling. It is especially relevant to occupational therapy practice. Cognitive behavioral theory has been applied in occupational therapy by Johnston, Taylor, and Babis.
The theory client-centered was developed by Carl Rogers. This theory believes that human beings possess the potential for directing their own growth, development, and life. Mental health problems occur when a person is not aware of feelings and the available choices. Therapist provides unconditional positive regards. Therapist is a mirror for the client to see his or her own thoughts and behaviors. Some techniques used are open invitation talk, closed questions, minimal response, reflection of feeling, paraphrasing, and withholding judgment. This theory is not useful with people with severe intellectual disabilities. Techniques useful in psychiatric occupational therapy to help clients to express themselves and for establishing a solid therapeutic relationship.
Neuroscience theories. Central concepts in the phenomenon we think of as mind and emotion are explained by biomechanical and electrical activities in the brain. Normal human function requires a brain that is automatically normal. Use of these theories requires significant knowledge of the anatomy and physiology of the nervous system. Treatment is directed by the brain's anatomy or neurochemistry. Electroconvulsive therapy is also used. Laura Jean King developed the sensory integration approach to the treatment of schizophrenia. Allen's focus is on adapting the environment to the disability.
Many great researchers work to form these theories, and because of them, we are able to use them today in our practice. We base what theories we will use for the client by determining their diagnosis and what will allow them to grow and become as independent as possible. Depending on what the patient's condition is, we can use different theories or combinations of theories in order to assist the patients in meaningful ways.
Socio-political climate and mental health. Understanding the impact of socio-political climate influences OTs to meet the occupational needs of a wide variety of persons, groups, and populations. OT members' involvement in legislative efforts, state occupational therapy governance committees, and continued efforts to educate external audiences has been named a priority in the coming years. There are many areas of practice that OTs can assist in, and because of that, we can reach a large majority of patients in different settings and throughout a wide age group. As more legislation is passed and occupational therapy is recognized from different levels of the government, it will be allowed to grow as a field.